everybody, this is Travis Robbins again from Robbins Rehabilitation, one of the owners here that's talking about low back pain and sciatica months here at Robbins Rehabilitation, which are December and January when we see a ton of our low back pain patients come in. So if you missed the first video, the link to that will be below this, so I would suggest watching that first and then coming back to this one. If you watched that one, good job, you can watch this one. So, we talked about in the first video, the number one reason for low back pain and sciatica is not keeping a neutral pelvis. Right? The second most common reason that we see problems with low back pain and sciatica in our offices is actually poor hip and lower extremity mobility. So that might not make a ton of sense, but hopefully after I'm done talking, it will make some sense. So, if you can't move your hips properly, then what happens is you put more stress on your lumbar spine. So we talked about in the first video being able to bend forward, keep a neutral spine. When you bend forward, keeping a neutral spine, and your hips stop, if you want to bend forward any further, then you have to kind of get that out of your lumbar spine, and that's where people run into trouble. So we're going to show you two quick tips today about how you can improve the mobility of the muscles and the joints in your hips. So we're going to use lacrosse balls, and if you've been in here in our offices before, you've probably seen these because we use these quite a bit. But it's a great way to loosen up tissue that's not moving properly and help to mobilize that and get more range of motion out of the hips. So the two things that we do the most for patients that are having trouble with forward bending are a release for the posterior hip. Okay, so in the posterior hip, there's your glute muscles, there's your posterior hip joint capsule. There's lots of different fascia and structures that can that don't allow for full motion of the hip. So getting in there and putting some pressure on the back side of your hip with a lacrosse ball, and then doing simple mobilizations to kind of loosen up that tissue is something we commonly do in our offices. And the great thing is it's something that we commonly give for a home exercise program because it's a really simple thing to do, and it's a fairly inexpensive piece of equipment, kind of similar to a PVC pipe. So the prescription that we look at for posterior hip, in terms of how much you do that for, is 2 minutes. Okay? So you would kind of get on that posterior hip with the lacrosse ball. Hip kind of goes in and out, and every 4 or 5 reps change the position of that on the posterior side of the hip so that you get a different contact point and you loosen up all the different structures that are back there. So set a timer for 2 minutes, every 4 or 5 reps, change the position of the lacrosse ball, do that on both sides. Okay, so now you're talking about 4 minutes total. The next set of muscles that we have to kind of get to improve mobility are the hamstrings. So a lot of people, bending forward and touching your toes is something that's difficult to do, and a lot of it has to do with poor hamstring flexibility. So, same thing, we're going to use a double lacrosse ball here, which by the way, we sell these in our office, but if you have 2 lacrosse balls at home, you can throw tape around them, it works the same. So, from here, just kind of putting pressure down, same thing on the back side of the hip, and then running that knee through flexion and extension, and dragging the hamstring tissue across those lacrosse balls will break up inflammation, scar tissue that's developed over years and years of use, whether you were an old athlete and played sports in the past, or current athlete, or if you have a physical labor job, or even just, unfortunately, a lot of sitting. A lot of our patients do a lot of sitting, and this will also decrease the flexibility of the hamstring. So same thing, 2 minutes on each side, every 4 or 5 reps, moving the lacrosse balls to get different parts of the hamstring. So after you loosen that up, the next thing you have to do is a stretch to kind of get that tissue lengthened the way you want it to. So for the first one, we'll do the hamstring, just extending your leg and getting on the edge of a chair, and then same thing, thinking about a neutral pelvis, right? So if I've got my pole back here, and I've got on the back side of my spine, and bending forward, and just going so you feel that stretch in the back of the hamstring. Okay? And I don't have to go very far. I have fairly flexible hamstrings, but I could use some work. But I don't have to go very far until I feel that stretch there. Okay? And for a prescription for this, sustained holds. So it's 2 minutes. Okay? So a 2-minute hold on each side. Okay? And the other stretch that we'll do for the posterior hip is similar. So you're just going to kind of cross your leg over like this, and then same thing, feeling like you've got that pole on your back, and then leaning forward until you feel that stretch in the back side of the hip. So don't get that flexion out of your low back. That's what we want to try to avoid. Good posture, leaning forward, and getting that stretch in the back side of the hip instead of out of the low back. Okay? So same thing, 2 minutes each side. So that's 2 stretches that you can do and 2 lacrosse ball mobilizations that are really simple to do at home to increase the flexibility of your hips, and that will take pressure off your spine, and it will help to prevent low back pain. Alright guys, that's it for video 2. A couple things, if you didn't watch the previous video, go back and watch that. Great information in there. Number 2, if you have any questions about back pain and sciatica, then email me. Just reply to this email. It goes right to my email box and I'll get right back to you and answer any questions that you have. And stay tuned for our 3rd video in this series, which should be coming up pretty soon. And we'll see you in video 3.